So, thank you. I'm not going to use any slides to talk for just a few minutes on this topic. My challenge for this debate was to support the idea that all patients should be offered revision who struggle with weight regain. And that's a position that I can't defend because, as I've elucidated some of my own thought process yesterday in selecting patients for revisional procedures, obviously I have some strategies that would interfere with my being able to argue that position. What I do feel strongly about, and Dr. Still and I are going to agree together, I think, with this position, is that all patients who suffer from this disease should receive treatment for it. And in the world where we have various available treatments of variable effectiveness, then patients deserve treatment because it is a disease. It's not a personal failing of behavior for the majority of patients. They suffer a metabolic disease, and we owe them treatment. We're healthcare providers, physicians, we treat disease, and we need to offer treatment. Now, in cases proven to be candidates for revisional surgery, that might be the best option. But as surgeons and doctors and healthcare providers, we have a responsibility to always be analyzing the risk versus benefit equation. And I can certainly propose to you scenarios where we will all quickly agree the risk may now outweigh the benefit of further surgery. For example, I could argue here that doing a redo operation may make sense under certain circumstances, but what if it's now the fourth or the fifth operation being proposed on the stomach? We all recognize that eventually the risk is going to be greater than the benefit, and we have a responsibility to the patient and to the public not to do things that are dangerous unless the benefit is tremendous and needs, life-saving intervention. So in a world where we have conversions from one operation to another, I certainly support, particularly when the patient has had a less effective, less powerful operation from a metabolic standpoint, I support the concept that the patient should be evaluated for a second procedure that's more metabolically powerful that could provide for a better outcome, a better result. But again, always bearing in mind that risk-benefit equation for the individual patient. We're getting, as you heard yesterday, we're getting risk calculators based on data starting to come out. There are scoring systems out there. I was very involved in the obesity surgery mortality risk score development. So we do have tools to allow us to look at the risk for an individual patient. But my message is that we should treat all patients with this disease. Even if it's very simple things that we're trying to do to help the patient. I encourage my patients in my information seminars to never give up trying to achieve successful treatment with this disease. As we know, people get discouraged and they stop working towards their goal. So our goal, I think, as healthcare providers is to keep working with them, keep trying, try to get a better result. You know there's benefit to doing that. There's better health, there's longer survival, there's benefit to the healthcare system in terms of costs. So that's my message. Let's all keep trying to help the patients. Thank you very much.